Well, thank you for including me in this seminar, and I have to say to Dr. Minyard, I feel like I'm honored to be asked to help you with this, and I cannot thank Georgia State and the Health Policy Center enough for what they've done for us. We got involved with them and sort of, they'd worked with the governor's office in public health more than and hadn't really worked with the legislature a great deal, at least not that I knew about, until we were discussing certificate of need. And let me tell you, I don't know whether you know what that's like, but in our state, I was the chairman of the committee that was looking at it and going to make changes, and I practically needed a bodyguard because the hospitals were so against it and it was such a hot topic. So they did, and I knew it was going to be that way, so we asked that they would do a workshop for us, a one-day workshop for our members who really knew very little about certificate of need. And that was a very successful, informative process. And then we had the Medicaid and Medicare issue where people didn't know what she was talking about or didn't know the abbreviations, and so they had a workshop on that and did a little cheat card that the legislators could carry around with them to understand that. And so just gradually, they became more involved with the actual legislative process. And as health chair and as a member of the General Assembly, things move very rapidly. We have a 40-day session. That's a 40-day session when we are gavelled into the chamber. Runs usually about 3 months. And it's going lickety-split. And you're being hit with not just as a member of the health committee, we each serve on about 3 or 4 committees. And so you're being hit with transportation issues, alcohol issues, school issues, just all of these issues. And it's very difficult to look at any of them in depth during the legislative session. I tell people all the time when I'm out in my community, call me ahead of the session. You can certainly call me during the session, but try to talk to me about your issues before session when I can really sit down and think about them. And it's the same way with the bills, and we know a lot about a lot of the issues that are going to come up before us. There's always the sleepers that you didn't know somebody was going to put in. But generally, you've got a feel, especially chairman, of what big issues you're going to face in a legislative session. But during the session, it's very difficult to slow down. The other problem we have is that we have 236 members total between our House and Senate. There are 8 of us, as far as healthcare, that have any hands-on experience. 8. There are some pharmacists, but they really run businesses. And other than that, we have farmers and insurance agents and school teachers and bankers and lawyers and just an array of people that know nothing about health care. And I tell you, I'm sick of hearing it's just a scope fight. Because it's not always just a scope fight between the doctors and the physical therapist or the pharmacists and the doctors. When it boils down to it, you need to look and see what it does for patient care. And that's often how the rest of the legislature looks at it. And that's not always the best way to do it. The session, like I said, runs very quickly. We're on a 2-year cycle. And we don't have term limits, but I will tell you, I don't think Georgia needs them. I've been in 18 years, and I am now, as of yesterday, somebody resigned, number 17th. In the hierarchy from the longest serving member in the Georgia General Assembly. So there is a very normal attrition of people coming and going. Not as bad as Florida, where they only are there for a couple of years, 4 years, 6 years, something like that, and then they're gone and you can be speaker in your second term. So that there is value to institutional knowledge, and I can tell you that. So anyway, when Dr. Minyard came to me as the health chair and went to the Senate health chair and was suggesting that we might really find value in this program, I said, yes, and just count me in. And I will need to talk to the speaker, and I'm sure that Dr. Thomas, who was chairing the health committee at that thing, will need to talk to the lieutenant governor. And one of the reasons that we needed to do it, if you're going to get legislators there, you have to pay them. And this was out of session, which is the perfect time to do it. So it meant that if my members were coming in to attend this seminar in Atlanta, that many of them would be driving 5 hours or 3 hours from all over Georgia, and many of them would need to spend the night. And they needed to pay per diem, and for us that's $173. And I needed the speaker's buy-in, and Dr. Thomas needed the lieutenant governor's buy-in. And luckily both were all for the program and have supported it each time that it's been offered again. So you have to have leadership buy-in, and I'm telling you, if you don't give them per diem, they're not going to show up. It's just the way it is. Dr. Minyard says that I'm responsible for people coming. That's because I was so impressed. I'm a former college professor, and you know, it had about driven me crazy the way that some of our legislators looked at health issues, and still does, I can tell you that for sure. And so I was all for the program, and I sort of did browbeat my committee members with multiple emails and the value of the program and the need for them to attend. And I think I have a pretty good attendance record. And what we're finding now, and just before session was over last Thursday night at midnight, I had a legislator and the minority party come up to me and say, Sharon, I really want to attend that, you know, that thing they're having over at Georgia State, you know, where you talk about health issues. And I said, well, you mean the health policy program? And he said, yes. And I said, well, I don't know whether I can okay a day of per diem for you, but I'll talk to the speaker, because normally I can only okay days that are for people in my community. But Dr. Minyard told me that there's been other people that have taken it, and they just didn't get their day, or we are allowed 7 days that we can take in our communities that nobody has to approve, and maybe they use those. So the program has grown because people, once they found out what it was like, then I think the word spread very quickly through the legislature. I'm trying to, and I will say that we have funding, or Georgia State has funding through the Robert Woodruff Foundation, and normally they don't refund any programs, and we're on what, the second or third, the third refunding. So you can tell that they see the value of legislators understanding and being able to look at programs in more depth. The program is bipartisan, and so when we come together, we are away from the Capitol, we're out of session. We have time to sort of sit down and think about things. At first, the program was 8 days. They were half days. But during the recession, the Speaker asked us to go to 4 whole days to cut the costs, and the Policy Center did that for us. So now we have 4 whole days, and it is bipartisan where we sit down together. We ask that, and Dr. Minyard asked that people leave what is said in the room, and people are allowed to say what they want to say. Now, when Dr. Minyard didn't mention it, but when we talked about what we were going to have and what they were going to model, I think my Republican colleagues, and I think I was in on this, was we are not going to put in stuff that we're going to legislate something for families to do. And we think that's something they should do on their own. And I'll know one thing that came up was about, well, we need to have children in school starting in the first year of their life through, or at age 1 through 3 years of that. Do you remember, Dr. Minyard, that being a thing? And as Republicans, we said, no way is that going to happen, that we're going to require that people put their children in school programs at, at age 1 and to 3. So those things were left out. So we do have disagreements, but they are not really contentious disagreements in the room, but they're different, and we discuss them. One of the problems with legislatures today, I think, is that because of all of everybody watching us and because they think we're all crooks and misusing their money and just going down and having a gandle time with a lobbyist, there has been a reduction in the number of times that legislators from both parties get together in a non-legislative time off, or when they have their families with them. The Georgia legislature years ago used to all go after session down to the Georgia coast And they, it was open. They brought their families and all. And they had the time to see that the other person really was human. They had a family. They had children. They had time to eat together and, as they say in the South, break bread together. And it's different when you see your colleagues on a different perspective, when you're not fighting over bills. And I think that is one thing that has been lost with all of the Common Core and things that are now in the press dogging the legislature. But this workshop gives us a chance to do that, to talk about things that we believe in on different issues. And like I say, in a bipartisan way. In the first class when we talked about doing the modeling, and I want to say you have to start off slow with legislators. I talked to Rachel last night and I said, Rachel, I've been reading all the information about this program. I'm not going to understand a simple thing about modeling. It's way above my head, and I'm fairly smart. And she said, it's okay. I think there will be a lot of people there, but I think, there'll be a practical. And I have, gained some knowledge and so forth, but a lot of it has been way over my head. I can tell you that for sure. And if you started with the complex modeling with legislators, you'd lose them on the first time out. So what they started with on us, and I can't stress it enough, is start slow and simple. We did the bucket. And how if you push the bucket here, is that legislation going to push a hole in the bucket up here? For example, our public health department decided at one point they were going to decrease, because of lack of funds, prenatal courses. Well, let me tell you, in Georgia, if you lower the number of prenatal courses taught around in the rural areas especially, because we have something like 40 counties that have no OBGYNs, and so mothers do not get prenatal counseling early and so forth, we would have an increased number of babies born ahead of schedule. And every preemie since almost every preemie since 65% of the state's births are on Medicaid. A preemie cost us hundreds of thousands of dollars. So to save a little money over here in public health would, hit the division that does Medicaid with a tremendous amount of increased cost. So, the bucket chart showed it. Then as we progressed, they went to the 3 boxes on healthy, people that were at risk and people that were already sick, and how we can move it back and forth. And then they got to the very extreme example where we had the input on looking at one issue. Now, we had issues to choose from. We chose obesity. I'm telling you, Georgia's at the bottom of the list, and I'm not proud of this. I'm not a Georgian by birth. I'm a Georgian by marriage, But I've been there 40 years, and it's my home state, and I love it, and I'm not going anywhere, even though I still love Texas, where I was born and raised. But we got a lot of problems. We have a huge obesity problems. We have a huge addiction problem. We're one of the leading states in gonorrhea, syphilis, and HIV. So you just name it, and we're up there. And of course, obesity leads to diabetes. And I can tell you across this country, if we don't find a way to control obesity and diabetes and dementia, the country's going to go broke. I mean, these are huge areas and huge problems, and Georgia's got them full, in spades. So we do face these problems, and so obesity became the one that we were going to study. And they put, the things in, and when she talked about the bill that had failed, usually in Georgia, by the time that a bill gets to the floor of the House, it has been so vetted that most of them, there's not a lot of discussion, and most of them are going to pass. And most of them are nonpartisan, and they'll have votes on both sides of the issue. And very seldom do we get into a ruckus fight unless it is a partisan issue like voting laws and redistricting and that kind of thing. I don't remember another bill going down like the one requiring and changing some of the ways that our state school board was going to handle exercise in our schools. Exercise was already required in the schools, but they weren't implementing it. And so it went down in flames. It was awful. And so in between that session and the next session, we did the modeling on obesity and found that one of the biggest and the best ways to decrease obesity is to have PE in schools and to have a good program. It reaches the largest number of children and is one of the most effective ways to do it. And out of that came a legislative effort to look at why it wasn't working. And we found that we had silos with the state school department and the public health. Now, since we did this, we have made public health its own department. It was sort of like a stepchild. It now has its own commissioner, that answers to the governor, and the two are talking to each other. They're out of their silos. And so we have implemented in our state what is called the SHAPE program, and one of the best parts of it is Power Up 30. And the next year, like Dr. Minyard said, we were able to pass a bill. Every student in our school systems are weighed. We get their height. It's their BMI that is sent home to their parents with some basic information on obesity and the need for physical exercise. And each school then aggregates all the scores on their students, and that is sent to the state school superintendent, and a report goes to the governor every year. And let me tell you, the schools that have bad ratings, they don't like it. And right now, we've had 530 schools sign up for the SHAPE program that covers 300,000 students, and the SHAPE, and one part of it is the Power Up 30. It comes from a school, I'm so proud, out of my district that I took the governor and the governor's wife and the head of the commissioner of public health to go. There are studies that show if you have 30 minutes of activity in your school day, at the beginning of your school day, that you will have increased scores in math and science and decreased behavior problems. And my school had that type of research and results from 4 years showing that that really works. It's free. It doesn't cost the schools anything, and that is being implemented across our states. Thank you very much for having me, and I'll be glad to answer questions.